to suspense. Members, I'm going to present my claims bill. I'm going to pass the gavel to our illustrious senator from Laguna Niguel.
Senator Lara.
Thank you, Madam Chair and members. This bill is the first of two annual bills to pay legal settlements approved by the Attorney General's Office and the Department of Finance. I'm offering amendments to delete one of the claims and to make some technical changes as noted in the analysis. The bill as amended would appropriate approximately 24.1 million from the general fund and about 141,000 from a special fund to pay settlements in 4 claims against the state. California First versus DGS, Charles Reed versus the FPPC, Sarah Wakely versus the Athletic Commission, and Dwayne Woodward versus the Athletic Commission. These settlements are valid obligations of the state and have some time sensitivity. And we have a representative here from the Attorney General's Office. If you have any questions, I respectfully ask for your aye vote.
Witnesses in support.
I'm just from the Attorney General's Office, and these are all valid settlements, and thank you for your aye vote.
Any witnesses in opposition? Finance.
The Department of Finance supports this bill because it provides the funds necessary to pay claimants and administrative approved settlements.
Thank you. Senator Lara, did you know that was coming from the Department of Finance?
I have no idea.
Yeah, no.
It's always good to hear.
Any questions, comments from committee? And you are, I'm sorry, Senator Nielsen.
I generally support the claims bills, but I always raise the issue that the state should vigorously defend proper claims or proper actions and not just automatically. That's not as to the claim, that is to defend the lawsuits. And it is my opinion in many cases in the past that we have not very vigorously defended. So I'm always looking for targets of opportunity to raise issues. I don't see any necessarily here today, but I will periodically reserve the right to say, hey, we should not approve this claim. We should send a message that we need to fight a little harder.
Any additional questions or comments for Senator Lara? Is there a motion? You have a motion by Senator Hill. Call a roll.
The motion is do pass as amended to the Senate floor. Lara?
Aye.
Lara, aye. Bates?
Aye.
Bates, aye. Bell? Bell, aye. Hill? Hill, aye. Leyva? Leyva, aye. Mendoza? Nielsen?
That bill would be on call to allow other members to add on. Senator Stone. Senator Stone, you have 2 items, SB 417 and SB 495. Both candidates for suspense will begin with SB 417. Please proceed.
Thank you, Mr. Chairman, honorable committee members. I'm honored to be here today. Larger and more rural counties face numerous challenges in making government work more efficiently. One of the challenges is the timely counting of ballots on election day. For larger and more rural counties, the transportation and process of turning ballots into the central counting place after the polls close can take several hours. This delays the counting process tremendously and prevents the timely reporting of ballots in the county. This is why I've authored SB 417. This bill would allow a county with a geographical area of 2,500 square miles or more to remove the ballots already cast at midday and safely transport them to the central counting place to begin the reconciliation process. No ballots counted early could be reported until the polls close on election night. The bill would also allow the Secretary of State to develop the process and regulation for transporting the ballots. As noted in the analysis, the cost to the state is minuscule, and the cost to counties who choose to take advantage of SB 417 will have the offset costs. The SB 417 has known opposition and is passed out of the Senate Elections Committee unanimously. I ask that this bill come off the suspense list at the appropriate time, and thank you for your consideration.
Thank you, Senator Stone. Witnesses in support of the measure. Witnesses in opposition. Finance.
We don't have a position, but we note that the Secretary of State estimates this bill would result in one-time costs of $50,000 general fund to promulgate regulations.
Thank you. Comments or questions from committee? Seeing none, we will place this, without objection, place this issue on the suspense file and look forward to working with you on this issue.
Thank you. Appreciate your consideration.
Thank you. Your next item is SB 495.
Thank you again, Mr. Chairman, honorable committee members. SB 495 is a very simple measure. In California, under current law, the seller of a property must pay a capital gains tax on the sale of real estate to the Franchise Tax Board once the escrow closes. SB 495 would allow a property seller the option to pay the capital gains tax on the sale of the property to the Franchise Tax Board once escrow closes or when that person files their state income taxes. This bill does not eliminate the tax. It only gives the seller another option to pay the amount owed. The bill has been narrowed to only apply to residents of the state of California. As pointed out in the analysis, the bill is revenue neutral. Any revenue that is lost this fiscal year will be returned the following fiscal year. Any costs to the Franchise Tax Board are also negligible. This bill has no known opposition and passed unanimously out of the Senate Government and Finance Committee. I ask for this bill to come off the suspense file at the appropriate time, and again, thank you for your consideration.
Thank you, Senator Stone. Witnesses in support of the measure. Witnesses in opposition. Finance.
The Department of Finance is opposed to this bill due to its negative impact on state revenues. Further, we note that changing the withholding requirement could reduce tax compliance, as some California sellers may not have the funds still available from the sale when filing their taxes. We do not have an updated fiscal analysis from the Franchise Tax Board on the amendments from April 22nd, but we understand that they expect it to narrow and to reduce the revenue losses.
Thank you. Comments or questions from committee? Seeing none, without objection, we will place this measure on the suspense file. Thank you, Senator Stone.
Thank you, Mr. Chairman. I appreciate the opportunity.
Thank you. Senator Morrell, you have one item. It's a suspense candidate, SB 728. Welcome, and please proceed.
Thank you, Mr. Chair and fellow committee members. I'll make my statements brief since this is a suspense item. SB 728 requires the California Public Utilities Commission to evaluate the economic impacts on our low and middle income tax individuals and families here in our state before increasing the renewable energy requirements that will perhaps severely affect them. This bill is all about opening the books, transparency, and of course fiscal responsibility. And once again, I can't say it enough, but protecting our middle and low income families. If the PUC has the ability to directly or affect the rates that Californians pay for their utilities, it should have the ability to first analyze the potential economic impact of that effect. I would argue that the potential savings to our ratepayers outweighs the cost of establishing this procedure, so I would like your help on that. Thank you.
Thank you, Senator Morrell. Any witnesses in support of the measure? Witnesses in opposition? Finance?
No file.
No file. Comments or questions from the committee? Seeing none, we'll place this measure in suspense. Look forward to working with you during that process.
Thank you.
Thank you. Members, we are now going to take a moment to take up some of the items that we have on call to allow members to vote. SB 302. Secretary, please call the roll.
The motion is due pass as amended to the Senate floor. Mendoza? Mendoza, aye. 7-0.
7-0. That measure passes. Next, we have SB 34. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Nielsen? Nielsen, no.
5-2. We will oh, cool. 5-2, that measure passes. Next, file item 445. I'm sorry, Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Mendoza? Mendoza, aye. Nielsen? Nielsen, aye.
7-0, that measure passes. Next, we have SB 580. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Mendoza? Mendoza, aye. Nielsen? Nielsen, aye.
7-0, that measure is out. Next, we have SB 323. Secretary, please call the roll. Oh, sorry, skip that one. I'm sorry, we have SB 667 by Senator Jackson. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Mendoza? Mendoza, aye. Nielsen? Nielsen, aye.
7-0, that measure is out. SB 323, Senator Hernandez. Secretary, please call the roll.
The motion is due pass to the Senate floor. Bates? Leyva? Aye. Leyva, aye. Mendoza? Mendoza, aye. Nielsen?
5-0, that measure passes. Next, we move on to SB 272 by Senator Hertzberg. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Nielsen? Nielsen, aye.
7-0, that measure is out. Next, we have SB 540 by Senator Hertzberg. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Nielsen? Nielsen, aye.
7-0, that measure is out. Next, we have SB 697 by Senator Hertzberg. Secretary, please call the roll.
The motion is due pass to the Senate floor. Leyva? Aye. Leyva, aye. Nielsen? Nielsen, aye.
7-0, that measure is out. Next, we have SB 188, Senator Hancock. Secretary, please call the roll.
The motion is due pass to the Senate floor. Bates? Aye. Bates, aye. Leyva? Aye. Leyva, aye.
7-0, that measure is out. Next, we have SB 490, Senator Bell. Secretary, please call the roll.
The motion is due pass to the Senate floor. Mendoza? Aye. Mendoza, aye.
7-0, that measure is out. Next, we have SB 739 by Senator Pavley. Secretary, please call the roll.
The motion is due pass as amended to the Senate floor. Bates? No. Bates, no. Mendoza? Mendoza, aye.
5-2, that measure is out. Last measure we have is by Senator Wachowski, SB 789. Secretary, please call the roll.
The motion is due pass as amended to the Senate floor. Leyva? Aye. Leyva, aye.
7-0, that measure is out. Thank you, members. We're now going to move to items that we've waived presentation on to allow witnesses to voice their support or opposition, beginning with SB 4. By yours truly, we can have witnesses in support. Please proceed.
Mr. Chair and members, Beth Capel on behalf of Health Access California, pleased to be here today in support of the chair's measure, SB 4. California does better when we all have health insurance and when we all have the health care we need. We want to begin by noting that the measure that is before you today is a substantially more modest measure than the measure that was before you last year, your predecessor measure, SB 10005. It does not include subsidies and covered California, substantially reducing the costs. We have also confirmed the cost offset, which were speculative last year, that this state does receive federal matching funds for those in restricted scope, even when they move to full scope Medi-Cal. Also, as your analysis notes, realignment and the managed care organization tax also provide offsets. And we would also note there's a reduction in hospital uncompensated care, which has an effect on our Medi-Cal rates as well. Ron Coleman from CIPC will talk more about the impact of the president's action, but we do note that that also has a very substantial offsetting cost, and we would hope that this measure will proceed from committee this year. Thank you.
Thank you. Go ahead, Mr. Coleman.
Good morning, Ronald Coleman here on behalf of the California Immigrant Policy Center, also here in strong support, and we appreciate the chair for bringing this bill forward. As we know, we have a discriminatory healthcare system that unfairly leaves out about 1 million Californians in this state, and investing in immigrant families is investing in California. They are a fundamental part of the state. They're 9% of the workforce. They contribute over $2.2 billion in a variety of taxes to the state, and we think California should take care of them since they help take care of California. So the time is now. This is very urgent. We know that the president's actions, which will ultimately be upheld on appeal, will even cut the cost of health for all in half. We'd probably be able to do this for about $100 to $300 million as we continue to leverage the 62% of the full cost of the comprehensive coverage by drawing down federal funds related to restricted scope Medi-Cal for all PRU calls, and that includes those that will receive deferred action. Though we still can do this today. We do know from the UC Berkeley, UCLA report that for 2 cents of every dollar, we can cover all low-income and undocumented immigrants in this state. And as Beth articulated, it's much more cost-effective and much more common sense to cover everybody up front. We've had a long history in California of covering all lawfully present immigrants in full-scope Medi-Cal, especially since California has recognized that it is much more cost-effective to provide preventive care than to pay for more expensive emergencies. We need to finish the job today and have the legislature pass and the governor sign SB 4 to ensure that we can cover all Californians. Thank you.
Thank you. Couldn't say it better myself.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, also here in strong support of the merits of this bill to undo the major failing of the Affordable Care Act, which is to cover our undocumented immigrants. Very much thank you for your leadership. We understand there's some uncertainty with the president's executive action being held up in court, but as also noted in the analysis, we're already spending some money on coverage for these folks and drawing down federal funds, but it's not smart to just provide emergency services and wait until people get sick. We need to provide the preventative care. As Mr. Coleman noted, these are folks paying valuable taxes to our society, that we need to recognize them as full citizens and provide health coverage. We do question the assumption of significant increased county enrollment costs, given the fact that most of these folks are already on restricted scope coverage. So we would call that into question. Very much appreciate your consideration coming off suspense. Thank you.
This is great testimony, by the way. Go ahead.
Kimberly Chen with the California Pan-Ethnic Health Network. Just wanted to echo the comments of our previous speakers that having folks in care early and preventative care reduces much more expensive emergency room care costs down the line. Thank you.
Thank you. Go ahead.
Gabrielle Lessard with the National Immigration Law Center. Also want to raise the point that when people are insured and able to get earlier treatment for medical conditions, they lose less time from work, and therefore they're more productive workers and better taxpayers. Also, the fact that insurance affects entire families. When one person in a family doesn't have health insurance, the entire family is at constant economic risk that they'll be thrust into financial devastation if a person has an accident or experiences an illness. Finally, I wanted to speak a little bit to our optimism about the case that's currently pending, Texas versus the United States, challenging the president's executive order that expanded DACA and created the Deferred Action for Parents program. We have been, the National Immigration Law Center has been active in that case, both as an advisor and as counsel to amici. And we are confident that the state's case is not legally sound and that we will prevail. And a bipartisan group of law professors, real legal experts, have written an amicus brief and released a letter stating that they share the same position, that they just really don't think that the states will prevail on the merits.
Thank you. Additional witnesses, if they can identify themselves and their position.
Mr. Chair and members, Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. We're in support of this bill. It will reduce the costs for the uninsured at the county level. Thank you.
Thank you.
Mr. Chairman, members of the committee, Noep Adamo, representing California Rural Legal Assistance Foundation, in support of the bill. This bill will help undocumented farm workers access health in the Central Valley and go to alleviate the hurting that's going on and benefit families and children. So we urge your support. Thank you very much.
Thank you.
Mitch Seaman, California Labor Federation, also in support.
Janice Canallen, on behalf of the California Children's Health Coverage Coalition, including Children Now, PICO, United Ways of California, Children's Defense Fund of California, the California Coverage and Health Initiatives, and the Children's Partnership, in strong support.
Erin Mercer-Niehaus with United Ways of California, a state association of 35 local United Ways, in strong support of SB4. Thank you.
Jim Lindberg on behalf of the Friends Committee on Legislation of California. We're in strong support.
Sandy Valenciano on behalf of California Immigrant Youth Justice Alliance that has 13 organizations all throughout California in strong support.
Dennis Garcia on behalf of the California Latinas for Reproductive Justice and the Latino Coalition for Healthy California in strong support.
Mike Montgomery with the Congress of California Seniors. We support the bill. Thank you.
Seth Bramble here on behalf of more than 300,000 members of the California Teachers Association in strong support.
Jody Hicks on behalf of the California Academy of Family Physicians in support.
Thank you. Additional witnesses in support. Witnesses in opposition. Please come forward.
Hi, nice to see you. My name is Dorda Jensen. I live in Davis, California. I'm against this bill because, the fiscal aspects could be pretty big since both of the bills, the legal actions that you're basing it on are up in the air at the moment. The ACA is held up in the Supreme Court, and like was said, the DAPA and the expansion of DACA are held up in Texas. So it seems to me presumptuous of the state of California to think that it should, to insert itself on federal issues like immigration and national health care. So I'm in opposition to this because I think it should have gone to the Judiciary Committee to begin with to be sure it was on firm legal ground. That didn't happen, so now we're on the Fiscal Commission, and I certainly want everybody to be healthy here in California, but to do so, I think we should expand our clinics for anyone who of low income so that people could get care that way other than having them enroll in a big statewide program when they don't have legal status to begin with. So thank you very much. Hope you have a nice day.
Thank you. Appreciate your testimony. Finance.
No file.
No file. Members, comments, questions? Senator Bell and then Senator Leva.
Just a comment on enrollment. Most of the larger counties have Children's Health Care Initiative. We did ours in 2001 in Santa Clara County. We were the first county to say that all kids will get health coverage regardless of immigration status. So we developed this enrollment program to sign up the kids. It seems like those managed care plans, when they're already going about signing up kids that are undocumented, it'd be rather simple because they're contacting the families in the first place to sign up families that have kids that are already, it'd be pretty simple. And I wanted to see if that's the opinion of other people, because I think the enrollment process is pretty much a standard enrollment process that's already been done for a long time in most of the large counties. So I think it's not really true that we have to set up this brand new enrollment process. We already have one. We already have one that works pretty good. And we'll see what, I want to ask the question, is that true?
Go ahead.
Beth Capel on behalf of Health Access California. As you probably know, as the chair knows, and as you probably know, Senator Bell, as a former county supervisor, you can go, a family that shows up at the welfare office can sign up for restricted scope coverage today. That's what Western Center was alluding to, and certainly that's existing law, and so we don't anticipate substantial additional administrative burden. Thank you.
And then the other factor is the emergency rooms, the emergency services that undocumented get. That's been tabulated, I think. Has that been calculated? And does this offset the cost that we're talking about here? It seems like it would, because you go into an emergency room. I know when I chaired the hospital committee in our county, if you walk in the emergency room, it's several $1,000s to cost just walking in the door, because we have a full service emergency and trauma center. So you walk in there it's going to cost a lot of money just walking in there in any kind of emergency kind of room. And a lot of the emergency rooms are full of undocumented, and we spend a lot of money on it. So, and we hate it. We'd rather have them have health care, preventive health care and so forth, which is much less expensive. So is there an offset in that situation? Can somebody comment on that?
So if I may, as the chair, there's the estimated cost around, the cost for the emergency room care is close to 1.4 billion annually. So we can easily cover that given now the president's actions, the limited, us further limiting the bill. Right. So it does make sense for us to do that. And again, that's very limited scope. That's very, a lot of the folks that are using our emergency room care are using it as some sort of preventative care, which is not appropriate because, this should be limited towards emergencies. This is the only way these folks get access to any type of care. So by setting this program up and by approving the bill, we're able to give them a much more and a better avenue to seek for preventative care and a more comprehensive care for the entire family, especially for those families that are in mixed households.
And I had one more, Mr. Chairman.
Go ahead.
A lot in our community, we have these nonprofit community health care clinics called FQHCs, and they take anybody walks through the door also, just like our emergency room does. And it seems like they provide this as, quote, charity care that they have to eat and get balanced by the offset of the FQHC funds, correct? And can you comment on that as to whether or not this bill would in effect be funded through those funds that are now used to offset the, quote, charity care that's provided to from a fiscal standpoint?
Again, to the chair, Beth Capel on behalf of Health Access, absolutely, the community clinics have been among the strongest supporters of this effort because of their desire to be part of providing comprehensive care, as are our public hospitals, as you heard today.
Yeah, it seems like when people say it costs this much money, on the other hand, it saves a lot of money. I think we have to have that number. When I looked at the report, I needed to see that, okay? And then we need to do a little more explaining on that, I think, in this.
We're all working on those numbers, Senator Powell. Senator Leyva.
Senator Laura, I just wanted to thank you for bringing this bill forward. Prior to being elected to the Senate, I spent 20 years in the labor movement where we fought for affordable health care for all. It was not our job to ask what someone's immigrant status, if they were an immigrant or not. We fought for all workers to have access. If you're here in this country, part of our job is to make sure that you are well in this country. Healthcare should be a right for everyone. It should not be a privilege for everyone. It is well and long documented that emergency room care is the worst care, not because our emergency room folks aren't very talented, but that's not where you're supposed to go for your care unless there's an emergency. It is also the most expensive care. So I just applaud you for bringing this forward and happy to support the bill.
Thank you. So with that, we would place this measure without objection to the suspense file. Next, we have SB 376. Witnesses in support. Go ahead.
Chairman Lara, members of the committee, thank you for your time. My name is Catherine Leiberger, and the president of AFSCME Local 3299, which represents workers at the University of California, and also president of the California Labor Federation. I'd like to address the University of California's own cost estimate for SB 376. Their cost estimate is $66 million, and we find it troubling. We assumed that given the importance UC places on a strong working relationship with those in the legislature responsible for fiscal and budgetary
issues that UC provided an extensive set of materials to the committee staff to analyze Chairman Lara's bill. So did that documentation show how many actual low-wage jobs UC contractors are creating? The bill analysis did not answer that question, which is central to the purpose of the bill. We suggest that the committee ask for the information by job classification. Anything short of that should give the committee cause for concern and skepticism. Based on our knowledge of wage and benefit costs, UC's $66 million estimate indicates 3,000 to 4,000 jobs with low wages and inadequate health care coverage, health insurance coverage. If so, what is the cost to the general fund for the social services used as a result of that number of low-wage jobs, and should that cost be included in the committee's analysis? Based on our experience with UC, we think it will become apparent that the committee can substantially reduce UC's $66 million estimate between now and when suspense items are taken up for a vote. Thank you.
Thank you. Witnesses in opposition?
Good afternoon, Mr. Chair and members. Jason Murphy on behalf of the University of California. As has been previously noted, the university's fiscal estimate for this bill was $66.354 million, $66 million of which was attributable to the expected increase in salary and wage costs, and then approximately $350,000 in extra administrative costs for the purposes of rebidding bids that would be precluded from extending or renewing due to the bill as well. So happy to continue to have further conversations with the appropriations staff to further look into our estimate, but this time we remain opposed.
Thank you. Finance?
No file.
No file. Comments or questions from committee? Seeing none, we will, without objection, move this bill to suspense. File item SB 502, witnesses in support. 504, witnesses in support. Witnesses in opposition. Finance?
We don't have a position, but we note that this bill could result in a loss of revenue to the trial courts since the bill excludes individuals ages 18 to 25 from paying fees for the cost to hear a petition to seal a record. In addition, if a court approves a petition to seal a record, locals would be unable to charge a fee for sealing the record. This bill may create a reimbursable state mandate with unknown but potentially significant general fund costs.
Would have taken a no file on that one. Right. Comments or questions from committee? Seeing none, without objection, we'll move this bill to suspense. Moving to SB 24, Senator Hill. Witnesses in support. Witnesses in opposition. Finance?
No file.
No file. Comments or questions from the committee? Seeing none, without objection, we will move this bill to suspense. Next item is SB 27, Senator Hill. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we will move this bill to suspense. Moving to SB 68, Senator Liu. Witnesses in support. Witnesses in opposition. Finance?
No file.
No file. Questions or comments from committee? Seeing none, without objection, we will move this bill to suspense. Moving to SB 172, Senator Liu. Witnesses in support. Witnesses in opposition. Finance?
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this bill to suspense. Next item is SB 636, Senator Liu. Witnesses in support. Witnesses in opposition. Finance?
No file.
Questions or comments from committee? Seeing none, without objection, we'll move this bill to suspense. Moving to file item 429, Senator Jackson. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, this bill will move to suspense. SB 137, Senator Hernandez. Witnesses in support.
Beth Capel, on behalf of Health Access California, pleased to be one of the organizations co-sponsoring this measure. We will work with your staff while it is on suspense to clarify that there's no intent to cost tens of millions of dollars. Both Medi-Cal and Covered California have created, Medi-Cal already has a uniform provider directory with that and has had for the last 20 years. So we'll look forward to further conversation while the measure's on suspense. We would note that all of the costs are fee-supported special fund. There are no general fund costs. Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, one of the organizations sponsoring this measure, also in strong support. Thank you.
Additional witnesses in support? Witnesses in opposition? Finance?
No file.
Comments or questions from committee? Seeing none, this bill would, without objection, moves to suspense. SB 147, witnesses in support? Witnesses in opposition? Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we'll move this bill to suspense. SB 282, Senator Hernandez, witnesses in support? Witnesses in opposition? Finance?
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to suspense. SB 461, witnesses in support? Witnesses in opposition? Finance?
We're neutral on this bill because we think it could provide long-term savings to the state from the avoidance of future maintenance and rehabilitation costs if the highway segments are relinquished.
Thank you. Comments or questions from committee? Seeing none, without objection, this bill will move to suspense. Next item is SB 163, Senator Hertzberg. Witnesses in support? Witnesses in opposition? Finance?
No file.
Without objection, we will move this bill to suspense. SB 286, witnesses in support, witnesses in opposition. Finance?
No file.
Without objection, we move this bill to suspense. Moving to SB 170, Senator Gaines, witnesses in support, witnesses in opposition. Finance?
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this bill to suspense. SB 343, Senator Hancock, witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we will move this bill to suspense. SB 498, witnesses in support, witnesses in opposition. Finance?
The Department of Finance is opposed to this bill. This bill could result in significant costs to the DOJ to compile data and develop a database to meet the additional requirements of this bill. Additionally, the bill requires DOJ to collect certain information from local entities, and to the extent that those local entities don't currently collect that information to report, it may result in additional workload and a state reimbursable mandate.
Thank you. Without objection, we move this bill to suspense. Next item is SB 229, Senator Roth. Witnesses in support, witnesses in opposition. Finance?
We don't have a position, but note that the bill appropriates approximately $16 million from the general fund to Judicial Council to fund 10 judgeships and supporting staff, as well as a new appellate court justice and supporting staff.
Thank you. Without objection, we move this bill to suspense. Next item is SB 252, Senator Leno. Witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we move this bill to suspense. SB 703, Senator Leno. Witnesses in support, witnesses in opposition. Finance?
No file.
Without objection, we move this bill to suspense. SB 276, Senator Wolk. Witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we move this bill to suspense. SB 765, Senator Wolk. Witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we move this bill to suspense. Next item is SB 296, Senator Canella. Witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we move this bill to suspense. The next item is SB 435, Senator Pan. Witnesses in support, witnesses in opposition. Finance?
No file.
No file. Without objection, we move this bill to suspense. Next is SB 460, Senator Allen. Witnesses in support, witnesses in opposition. Finance.
No file.
No file. Without objection, we'll move this bill to suspense. SB 640, Senator Bell. Witnesses in support. Witnesses in opposition. Finance.
We don't yet have a position, but note that the BOE estimates preliminary cost to implement this bill would be from $500,000 to $600,000 annually, plus one-time programming costs of $200,000. According to the BOE, the ongoing fiscal impact of this bill is indeterminable. To the extent additional refund claims would be filed, the bill could result in state and local revenue loss.
Thank you. Without objection, we move that bill to suspense. Next, we have SB 674 by our fearless leader. Witnesses in support. Witnesses in opposition. Finance.
The Department of Finance is opposed to this bill as it results in state reimbursable costs to several local agencies, including local law enforcement, prosecutors, and any authority that has responsibility for the detection or investigation or prosecution of a qualifying crime or criminal activity, such as Child Protective Services.
Thank you. Without objection, we move this bill to suspense. Next is SB 695 by Senator De Leon. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Without objection, we move this bill to suspense. Last item is SB 723, Senator Pavley. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Without objection, we will move this bill to suspense. And that concludes our appropriation hearing for today. Thank you, everyone, for being here.